The treatment options really depend on the age that you develop the symptoms for the fibroids. So obviously a person who has fibroids and has no symptoms, they don't have to be treated. These are benign tumors. They're not going to eventually develop into malignant tumors. So you don't have to treat them if you're not having symptoms. A lot of times patients who present earlier in their an earlier age group with fibroids either develop massive fibroids and they can actually feel them. So that's how they present, or they're having problems with pregnancy. So, and then as far as the older groups, they tend to develop symptoms of bleeding symptoms, so heavy menstrual periods. They may also develop, the fibroids tend to grow and push on other structures. So they may develop, the uterus is right next to the bladder, so they may develop frequency of urination. It's near the back, so they may develop back pain associated with menstruation. Sometimes they'll get constipation because it's pushing on the colon. So all these things can, because of the location of the uterus, it can affect other structures in that area and then cause these type of symptoms. So hysterectomy means that you're removing the entire uterus. So obviously, once that happens, you're not able to become pregnant again. Another surgical option without removing the entire uterus is called myomectomy, which means you remove those specific fibroids or the largest fibroids and leave the rest of the uterus intact. And then other options would be something called endometrial ablation. If the fibroid is in the inner lining of the uterus, the gynecologist can put what's called a scope inside the uterus and then burn out that fibroid. What we perform as interventional radiologists is something called fibroid embolization. And the idea behind that is that we try to kill the fibroids internally. Fibroids are very vascular, meaning they need a lot of blood flow to live. So if you can primarily attack the fibroids themselves, leaving the uterus intact, you can kill the fibroids and have a normal uterus. The way it's performed is by putting a small catheter inside the artery supplying the fibroids. We inject these tiny microscopic particles into the blood vessel supplying the fibroids, and then over time that will kill the fibroids. So that's another option.